CBS News medical contributor Dr. David Agus joins us now. David, first of all, this note, which we thought was a pretty remarkable number and a marker, the number of Americans fully vaccinated, 28.7 million, is now almost exactly the number of Americans infected since the beginning of the pandemic, which is 28.8 million. For those who get the vaccinations, the CDC, as we mentioned, has delayed that guidance. What do you expect it will be when it comes out?
I think the guidance is going to say the following, is that you can get together in small groups of vaccinated individuals where everyone is vaccinated without a mask. But whenever you go out in public, whenever you go out of the house, you have to wear a mask and you have to social distance. If somebody is vaccinated, they can have a low level of virus, but another vaccinated person should have enough immunity to deal with that. So it's going to be different rules for those who are vaccinated in the house, but the same when we go out.
So a growing number of states, you have Texas, you have Mississippi, Connecticut, opening up, easing restrictions, really. What do you say to those states? Is that something you encourage or certainly frown upon?
Well, the problem is something that happens in Texas affects the rest of the country because people travel. The only reason to let down a mask mandate, to take it away, is political. When you look at the data are clear. We have to continue wearing masks for several more months. We have to social distance. If we don't do those things, we're going to have a continued spread of the virus. And with these new variants, I am worried that it's going to be a very quick rise in number of cases.
David, one of the debates that I feel like we've seen since the Johnson & Johnson vaccine was approved for use is this idea that it's not as effective as the other vaccines, people not wanting to take them. We've also heard from some religious leaders. There's just been a lot of talk saying that's not the one for me. Can you remind people again why all of these vaccines are worth taking and it's not worth picking and choosing, get what you can get?
Thank you, Dan. There's no question, is that all of these vaccines, all three of them, block hospitalization and death 100% in the clinical trials. While the number at 28 days showed that you were 72% protected from virus, from symptoms, when you go out a month or so, those numbers go up, and it's a very long-lasting protection. In fact, the Johnson & Johnson vaccine has shown the best protection against the South African variant. So it's an excellent vaccine. It's one and done. It is not getting a second-place vaccine. All three of them, take whichever you can get first. A day earlier means a day earlier you are protected.
I got to tell you, my heart sank hearing Dr. Fauci say by the end of the summer or fall is when all Americans who want a vaccine should be able to get one. Are we going to see a return to normalcy in summer somewhat as we see more people vaccinated at least?
Oh, no question about it, is that there will be enough vaccines, the president said last week, for all adults by May. And so this summer, if you get a vaccine and you're with other people who are vaccinated, the restraints or the restrictions will go down and down. So we're not going to have a normal summer, but we're going to be able to do many of the things that we haven't been able to do for the last year. The vaccine science is going to get us out of this pandemic and allow us to live a more normal life.
It was a year ago you told us we had to get ready for a new normal, and you were right. You are right now. Dr. David Agus, thank you. We appreciate it.